My name is Shannon Moody. I am from Kentucky Youth Advocates. I oversee our policy and strategic initiatives work, and we're really grateful to have you all joining today. You are going to hear from several different folks from across Kentucky around kinship care and kinship families. September is Kinship Care Month, and we're really excited to be able to bring this webinar to folks during this month of awareness and recognition of our families and fictive kin who have stepped up to care for kiddos who are in need of a family member. So we're really grateful if you are serving in that role or if you are playing a role in supporting our caregivers as they navigate kinship care within their communities. So I see lots of names and counties and organizations in the chat. We're really glad to have you here. Today, we will hear from our friend at Casey Family Programs, who we are grateful to have, Dolores Long. We will also hear from Commissioner Lisa Dennis with the Department for Community-Based Services. And we will hear from a couple of advocates from Kentucky Youth Advocates, as well as the Kinship Families Coalition of Kentucky, to talk about what they learned over the last several months in an effort to better understand gaps in supports that are available for kinship caregivers. So we are going to jump in, and I am glad to be sending it over to Dolores Long with Casey Family Programs. If it not for Casey Family Programs, we would not be able to do this work. So we're really grateful for the support that Dolores and her amazing team provide. So Dolores, please take it away.
Thank you, Shannon. I'm very happy to be here. Good day, everyone. As Shannon mentioned, I am Dolores Long with Casey Family Programs, and I'm here today to talk a little bit about the national landscape with respect to kinship care. But before I begin, I just want to make it clear to everyone that Casey as well as myself, we both believe that all child welfare matters, be it prevention, protection, safety, or well-being, are community matters. And while I will speak to the agency or use phrases like agency today in my presentation, please know that I am in no way excluding community because I believe community has a role in this as well. I also want to make this disclaimer. Some of the slides that you will see is actually public information. This information comes from what's called ASCARS, which is data that is submitted by the states, territories, and some tribes to the federal government. And Casey utilizes that same information. So this is not Casey's information. This is technically public information. And I also want to make it clear that it is the most recent data, but unfortunately it is 2022. So what I'm speaking about is data from 2022. So as you can see, nationally, roughly about 34% of all children placed in out-of-home care are living with kin. The trends vary across the country, with state levels ranging from 10% to about 53%. In 2022, Kentucky was at about 14%. Now, we have noted that numbers have increased over the last few years, but unfortunately, we will not have that concrete data until much later. Take the next slide. This slide basically shows the demographics with respect to race and ethnicity. For the most part, and I think some of it is kind of cut off with the bars stand for, but for the most part, our Native American and indigenous children have a higher percentage in kinship care than any other group. And a lot of that is because of the Indian Child Welfare Act. The Indian Child Welfare Act puts forth some requirements that basically say that when you're dealing with nationally recognized tribes, the agencies must contact those tribes and utilize those tribes, and they are the ones who are responsible for ensuring the placement of those children, which is why you will see that Native American children, in terms of being placed with kin, use kinship placements more than anyone. At Casey Family Programs, we truly believe that ICWA is what is Indian Child Welfare Act, that it is actually the gold standard, should be the gold standard for all of our children, regardless of their race and ethnicity. But at this time, it only applies to Native American and indigenous children. And then lastly, this particular slide shows uh, the breakdown of the age range of children placed in kinship care. And I think no one here would be surprised to know that for the most part, younger children are placed with kin providers more often, more frequently than older children. And Kentucky, with respect to that, is no different than any of the other states in the nation when utilizing um, kinship care for younger children. Now, I'm going to bring forth a few other, what I would call some qualitative trends that is not on the slides, but I thought you all may be interested in knowing. Um, so I mentioned earlier that that there's a spread. Some states only have about 10% of their children using kinship providers, while some states have 53% of their kids in care using kinship providers. Well, what the trends show is the ones who are utilizing kin care most often, there's three guiding principles that they typically follow. The first one is they have a kin first culture. And what I mean by that is that they have shifted their approach to making kinship placement their expectation and goal rather than a practice exception or alternative. They actively engage their families throughout the life of their involvement with the agency. They use family team meetings. They have a rigorous family finding process. And they also make sure that they include fathers and paternal relatives. And they make sure that they prioritize the youth voice in all that they're doing. They also have reduced barriers to kinship care, and believe it or not, they have actually created barriers and burdens to non kinship foster care placement. So, for example, they have made it harder for agencies to place children in in what we would call traditional foster care. They've made that harder and have made it easier to place with kin providers. Secondly, they provide support to the children, the parents, and the kinship caregivers. They believe that it is the responsibility of the agency, not the kinship family, to develop solutions to provide the appropriate support in ways that are acceptable to the family and within the family's comfort zone. And they are financially supporting those caregivers. So they're going beyond TANF and they're going beyond GAP. And for those who don't know, TANF is temporary assistance to needy families, and that is an income based program that families can apply for. And then there's GAP, which is the Guardianship Assistance Program. And just to give you a little nugget, I love extra information. Just so you all know, as of December 2023, only 42 states, the District of Columbia, Puerto Rico, the Virgin Islands, and 11 tribes have federally approved guardianship assistance programs. So it's just a few more left, but I thought y'all may be interested in knowing what those numbers look like. But the states who are really utilizing kinship care, what they have done in addition to TANF and GAP, they're also providing child care subsidies. They have a pre-licensure per diem, and they have compensation that is similar to non-kin licensed caregivers. And then lastly, they identify and provide community-based support. And this is something that I really respect and value. They completely understand that support is not always financial or clinical in need, that families sometimes need additional supports outside of those two. And so what they have done in these high kin utilization states, they utilize kinship navigation programs. And these programs provide information, referrals, and assistance with applying for support, as well as increases social support.
Hey, Dolores, you got muted somehow.
Yeah, I see. I saw that. It came up and gave me a message. But the last part of what I was saying is that these kinship navigation programs increases social support, they improve family resources, and they improve child safety and placement stability. Um, So that is all I have with respect to the national trends with respect to kinship care.
Dolores, we really appreciate your overview of what we're seeing across the nation. And I know in a lot of ways, Kentucky is like our neighbors and like other states where we are seeing those trends. And also, there are things that make Kentucky unique. So we're grateful to hear that national landscape. And I think the kin first lens and the kin first approach is beautiful. And also, I think that we've seen some major commitment to that within the Department for Community-Based Services over the last couple of years. And I hope to see that continue. And I think we're going to hear from Commissioner Lisa Dennis and Kelly Root from the Department for Community-Based Services to give us a bit more information on current supports and updates that are occurring within the Cabinet for Health and Family Services on the landscape of kinship care. So you all can take it away.
Thank you, Shannon. And it is great to be with you all this morning. My name is Lisa Dennis, and I am the Commissioner for DCBS, and I have with me Kelly Root. And she is going to take us through some slides here in just a moment. But I wanted to say, well, I appreciate the information, Dolores, that you shared. As always, Casey's a great partner and supportive of lots of initiatives, but this is definitely one that we get a lot of support from Casey on. And in kinship effective kin care in Kentucky for the department, it's a priority. You've seen the data that Dolores shared, and 14% is an improvement from where we were in years past, but we still have a lot of work to do in this space, and we're very committed to it. We are getting closer. I think we are getting closer probably to 16% now. But like I said, we still have a lot of work to do in this space, and we recognize that, and we have done a lot in the recent years to really help our relative victim kin caregivers and to support them, and it's what you'll see here in the slides. But we want to do as much as possible, again, to support our relative victim kin caregivers, because we know what those benefits are for children. We see better outcomes overall, their health and well-being. We reduce trauma. We see stability for children who are placed with relative victim kin caregivers, but most importantly, we're preserving that family, community, and cultural connections. But we also know that this comes that there's a lot of challenges, right, for our victim relative kin caregivers. And so how do we support them better, and how do we make sure that they have the services that they need? So we are committed to that work, and appreciate everyone that's on here and helping us in this space. So I am going to pause and hand it over to Kelly, who's going to share some of those updates and things that we've been working on.
Thank you, Commissioner. Good afternoon. Thank you for having us. Really excited to speak to some of the updates here in Kentucky. And I think Dolores highlighted some of the best practices throughout the country, which is really what we want to move toward in Kentucky when it comes to, really building and supporting that kin first culture. So for the past several years, we've been working to implement a federal guardianship assistance program. Here in Kentucky, we are calling it something different because guardianship in our pathways and our court systems here in Kentucky really means something different. So we wanted to really call it what it is, which so it's subsidized permanent custody. So here in Kentucky, our caregivers, ultimately the permanency plan is permanent custody, and that is a subsidized option. So this launched on July 1st of this year, a new permanency option for families, supporting kin and fictive kin caregivers in this way. So this permanency option has some federal guidelines to follow, which is that caregiver is a approved foster home for that child for at least 6 months. So really working from the beginning to make sure that families really understand their options and what is the appropriate path for their family as far as ongoing financial support, and other types of non-financial support that can be offered through this program. We want to make sure that families understand that this is a permanency path when reunification or adoption is not the appropriate option, which we know for many families that we talk to, they want to maintain their relationship, right? They're not want to move toward adoption. They want to remain grandma or sister. And this allows that family to make decisions about what's best for them and best for their family unit. So with this program, families may qualify for childcare, respite, other supportive services that a non-familial foster family would qualify for. And this program also provides families with similar benefits for those that have adopted. We have not made rates different. The rates remain the same, whether you're an adoptive family or whether you're a kin family, which is something that we're really proud of here. We also, I know Dolores spoke to some states really stepping out and, helping support those families financially while they're going through the foster care approval process, which is something that we have done here in Kentucky for several years and continue to make that a priority. And then really taking a deep dive and look into the foster care approval process itself. I think the Children's Bureau recognized also states have that there are, innate barriers in the foster care approval process for relative and fictive kin that really are barriers for them being approved, such as how we approve a non-familial family. So the Children's Bureau, starting last November, allowed states to really have flexibility in how we develop standards for relative and fictive kin families. So Kentucky, we took that opportunity to do that. Along with subsidized permanent custody on July 1st, we also had new regulations that were set forth a different set of standards to be able to approve relative and fictive kin caregivers in a way that removes a lot of those barriers. So we are seeing more and more families, choose this path of foster care and being able to get them approved much more quickly with the new standards. Next slide, please. So one of the barriers that we definitely had recognized in the state was, we have a lot of options for kin families when they are child welfare involved. And that is really challenging for families to understand and also really challenging for our staff to explain. It's a complex decision and there's lots of pieces that are different for every family that we work with. So we, in partnership with the University of Kentucky, have regional kinship navigators. Those are being implemented in every region, and that navigator will be matched with a family as soon as that family is identified as a placement resource for a child. And that navigator will go in, talk with the family, make sure that they understand their options to either seek approval as a relative or fictive kin foster parent or seek temporary custody and what that looks like for that family. And depending on the family's decision, the kinship navigator will help navigate that family to the next part of the process. And then also really refer them to any resources in the community, any either grandparents groups or support groups that are within that specific region. We really thought it was important and believe that those navigators need to be in the region with the families where they can be aware of all of the different resources that look different across the state. So I think we have our last couple navigators that are being onboarded currently. And our hope is to expand this and have more navigators in every region as we anticipate and build out our kin and increase our numbers from that 16%, hopefully to get up to a 50% mark. That is our goal. And with this, we're also really looking at different technologies to help us with family finding from the beginning. We're going to have a new family finding program that will be launching soon that will really help us monitor and track what family we have identified what that outreach has been like, and what are any barriers to really connecting and staying connected with those kin. So a lot of exciting things going on in Kentucky in this space. Next slide, please. So we have partnered a lot with the University of Kentucky, and they have their Kentucky Kinship Resource Center, which has so many different umbrellas of supports under it that we really just keep adding to and infusing and partnering with them to support this population. So this opened in 2020 to really support kinship families, and they do it in a variety of ways, because what we hear when we're working with families that have lived experience or young people that have been with kin, we really want to build an array of supports that meet their needs where they are. So I will send out these slides. Of course, I'm not going to read everything. Those are pretty wordy, but it gives an idea of what are the different services that are in the Resource Center. So we have the KY Kins Peer Support Program, and that is our Kinship Navigator model. And that is really an individualized one-on-one peer support model to really support caregivers from those that have that lived experience. We know that that is the best kind of support, and research tells us, kin can support kin, foster parents support foster parents, and we really want to make sure that we are providing that support to families. There's also the Kin VIP program, which is the kinship support groups that meet virtually. And so that can meet caregivers wherever they are. And we really utilize data and surveys saying what are the greatest needs of the type of support group that families want. Families told us overwhelmingly, hey, I need a support group about grief and loss. I need a support group about having children with a parent that may be going through substance misuse. So we really have specific groups to meet the needs of what relatives are telling us that they need. And then there is the Kinship Catalog, and it's an online educational program, really to have immediate access for caregivers to go and get information on a variety of topics. And we've tried to do that in a way that really reflects adult learning. So 10 to 15 minutes, right? We know that our caregivers are busy and they don't have time to sit and maybe watch an hour webinar. Thank you all that are here today, right? But when you're parenting and working and doing this, it's great to be able to go in and access 10 or 15 minutes on a topic that's important to you. And so we really want to build out that catalog to be able to support families. Next slide. So KY Kins, this will be included in your packet of slides. This is really just some more information about that peer support. And we receive referrals. The program receives referrals either from the DCBS staff. It can come from the school. They can self-refer. So here's just a flyer that you could utilize yourself, or if someone that you know, there's the QR code for them to watch a video about the program and just learn more information. Next slide. And this is just, I really went ahead and highlighted the three main areas, but I wanted to include this information where you can see what are the current group offerings. Those are general kinship care, families impacted by substance use, and then there is an advocacy group. And then there's 3 new groups that are currently starting, and those are taking signups, raising special needs kids, building family connections, and dealing with loss. So those are all of those virtual options that families can go and get that virtual support through Kin VIP. And then here's the Kinship Catalog. So it just gives you a little bit of information about what that looks like. And these are really quick slides that you can share with families that you work with, just to let them know, hey, here's a resource for you that's free. You can go on there and access a lot of different types of support and really meeting families where they are throughout the process. And I think that was all of my slides. I know I tried to do that quickly.
Thank you, Kelly and Commissioner Dennis. We appreciate you sharing that about what's going on in Kentucky. I'll just share briefly about the listening sessions and just the information that we collected. In May, the Kinship Coalition hosted listening sessions and distributed a survey. The goal was to better understand the unique challenges faced by relative and fictive kin caregivers. And so we did surveys and listening sessions with kinship caregivers, fictive kin caregivers, and also providers. So folks that worked with that population. On the surveys, we had 182 responses, and then the listening sessions, we held 9 listening sessions in the different DCBS regions. So all 9 DCBS regions. We talked to 101 individuals across the Commonwealth, and they shared again about the gaps that they've seen in services and the needs that kinship caregivers have. So from that information that was taken, we have developed we have the findings of that, and I'm going to pass it to Norma, who will go over the findings and recommendations from that.
Thank you, Debbie. So I'm Norma Hatfield. I am a grandmother who's been raising 2 grandkids for 10 years now, and also president of the Kinship Families Coalition of Kentucky. And I have to say, it was a joy to be a part of this project. So grateful to Casey Family Programs, KYA, for doing this, because I know as a caregiver, our voice is important. We need to be heard. We're doing a lot of important work, taking care of these kids. And what is to me very fulfilling is to see the report that, from this presentation, the information in here, the fact that we have Commissioner Dennis, we have Casey Family Programs, everybody here all together, that shows this is important and it's a priority. I also want to thank CASA, Court Appointed Special Advocates across Kentucky, because they're regional, and they also co-facilitated these events with us. They helped set them up, get the word out, help with a lot of the logistics and getting these meetings together. And they made things so much easier for us to do this work and to share this with you. So I just wanted to do a shout out for the CASAs also and thank them. So some of the most common needs identified, I don't think anybody should be surprised here. Food, clothing, school supplies, IT support, peer support. We're going to break some of these down as we talk a little bit more about barriers and challenges. Mental health care, not only for the kids, but also for the caregivers. That one, I think, for me, I don't want to say I was surprised, but the fact that from this survey, more and more people were sharing that, because I can tell you over the years, a lot of caregivers just want to take care of the kids. They don't always take care of themselves. And that's why I think the mental health piece was really important. And that's what they're recognizing is they need some support as well. They need to talk to someone to help them process things. It's very complicated for caregivers, when you're dealing with family, and how the kids got into the situation that they're in, that you're taking care of them. And then legal assistance was another one that was on there. I think, when you look at these, it's pretty simple is, you're taking new children into your home, and there's a variety of needs that need to be addressed. Let's go to the next slide, please. Barriers. 1 in 3 caregivers found that workers that they interacted with didn't actively provide helpful resources. And it was for different reasons, whether they also didn't feel that they understood it, that, or whether they knew it or just missed that opportunity for that communication. But that was one of the things that kept popping up everywhere we went. A lack of interagency communication with the families in DCBS. That was another one. Worker availability. We know social workers are overworked, and that's what makes things challenging. And, 12% of caregivers felt that their age had a negative impact on the services they received. Let's go to the next slide. Now, system level changes, when we're looking at recommendations, expand community-based mentorship opportunities for youth and kinship care caregivers provide and facilitate comprehensive reunification services so that we have better opportunities for kids to return safely back to their parents, to their birth families, and provide counseling and mediation services for kinship families as part of the DCBS case plan. It's complicated. I say that over and over and over. I should just get a tattoo. Kinship care is complicated, but it truly is. When you think about the fact that in some of these, when you think about counseling and mediation and reunification, you have, as part of the case plan, the parents may be going into a counseling session, the kids may be going into the counseling session, but then the caregiver, the fictive kin, whether that's that or kinship caregiver, they're not involved. And that's when things can kind of get confusing, can get complex, is how, the kids come out of the session. As a grandparent, as an example, I don't understand when the kids come back to me and start asking a lot of questions. I don't know how to deal with some of those things because I'm not in the know. And there could be conflict with the way that I'm doing things and the way that they're being discussed in counseling. And I think the whole goal here is to, mediate those services, mediate those understandings, make everything possible, as easy as possible for the child as they're navigating between, the parents and potential reunification and navigating staying with, a kinship caregiver. You want to try to make that as seamless as possible to a child. Let's go to the next slide. Practice level changes. Provide comprehensive informational packets and education materials. Provide preference options for kinship caregivers on how to get that communication and utilize best practices. So what does all of this mean? Some of the things that we heard was, I don't speak DCBS. I don't understand all of the stuff that's coming at me. So the materials that they receive need to address all of those things. It is a whole different language. I've been a caregiver for 10 years. I'm still learning what some of these acronyms and terminology is. Kind of give a better timeline on how things work with the case. Give clearer list of benefits and resources for kinship caregivers so that they don't miss services and miss some window of time for that, and so that you can have the best available services for the kids in the first place. Another one that came out of that was health history of the kids. You get caregivers, you may have a grandmother that's in another county that doesn't really know all that's going on, and as much information as possible is what's best for the kiddos. Training resources, including things involving taking care of a LGBTQ plus child. As a grandmother, I might not be prepared for that, as an example. I need to understand a little bit more of meeting the kids where they are, dealing with all of the things, the system, the traumas, the child, and doing the best that I can, preparing me, giving me as many tools in a toolkit as possible so that I can help that child. And then also utilizing best practices when we're doing a placement of a kid, looking at disproportionality in the placement of a child of color. All of these types of things we feel that came out of these sessions across the state, those are some of the practice level changes that are recommended. Let's go to the next slide. Debbie, I guess it's back over to you.
Thanks, Norma. Okay, so from going to the different listening sessions and also just from a list of resources that we know exist, we have updated that on the Kinship Families Coalition website. So this is just a screenshot of it, but if you go to the website, there's a resource directory there. And resources can be looked up either by county or by resource type. So some of the resources that are listed on there would be like for things like your basic needs, also medical, mental health, mentoring, support groups. So if anyone knows of a resource that is not listed and you want to send it our way, feel free to do that. we do look into those. So like the list of support groups that are currently on there, we've done outreach to those to make sure that they're still in existence. So we hope to keep that just up to date. Yeah, so you can go ahead and check that out. And there's also the Kinship Caregiver Handbook. We will be updating that a little bit, but it's a great resource, especially for folks that are first-time caregivers. And then lastly, on the website, we do have the report, which that will go out in the follow-up email as well for you to check out, that shows those the recommendations. So I think we can go ahead and go into, there were some questions that were dropped into chat. It looks like the first one, I think Kelly, you had replied to it about if you have a kinship child in your custody departed July 1st, does one qualify?
Can we talk to Kelly? I mean, if
So I think there's two things there. There's been a lot of clarification that we have had to do in regards
Right.
to the July 1st date. So if a caregiver is a active foster parent and they were caring for that child on July 1st for at least 6 months, then subsidized permanent custody could be a permanency plan for that child. I think it's really important that to understand that the requirements for subsidized permanent custody or the federal guardianship requires that the caregiver is an approved foster family for that child and receives a foster parent per diem for 6 months. So families that have either temporary or permanent custody would not be eligible for this program for SPC. We would have to look at other, other options. Are they eligible for TANF? Is there childcare available? So we would have to look at other support options in those cases.
Yeah, thank you, Kelly. I wanted to clarify the difference there. So.
Thank you. The next question is, are there resources for kinship caregivers who are pursuing private relative adoption?
We do not have any at this time. Those families, of course, could be eligible for public benefits. But currently for those that are pursuing an independent relative adoption, there are not any financial benefits associated with that. The department, we do work with those families and see those petitions and do reports for the court in those instances. But there are no financial pieces to that.
And I seen that Shannon had asked the clarifying question of whether that was related to subsidized permanent custody or what we're offering through Kentucky KINS. And so what Kelly is talking about is private relative adoption. So if that's not, if that did not answer the question, let us know.
We do have some families that are, say they're a foster family for a child and the permanency plan is adoption. So we have many relatives that go that path and they adopt that child, from foster care. Those families are most likely eligible for adoption subsidy. The child has to meet certain criteria for adoption subsidy, but the majority of those families that are fostering a child and go through the adoption process receive those ongoing benefits through an adoption subsidy. And we have many families that that is their pathway and permanency plan.
Thank you. I'm going to go ahead and go to the next question. Is there hope with recommendations at the General Assembly that they'll pass laws in 2025 to address those? I'm not sure if I caught to address what.
To address the recommendations.
Oh, thank you.
Yeah. I can respond to that, and then Norma may want to weigh in. I think the recommendations that we had identified, both the systems level and the practice level, I think a lot of those things can be accomplished through working together with the Cabinet for Health and Family Services and the Department for Community-Based Services. We would definitely want to have some additional conversations to figure out what would need or require statutory change. But I don't know if we anticipate any of those recommendations being moved forward, for pursuit in the 2025 legislative session.
Yeah, and I don't really have anything else to add because Shannon pretty much covered that. I know when I see things bubble up from caregivers, we start with the cabinet to see what we can already do with the policies and things that are already in place, and then if it needs to go beyond that, that's when we approach it. So I don't see anything right off the bat that looks like it would be a legislative thing. You just don't know till you start digging in if you need that additional assistance, such as funding and things like that.
And the next question, and Norma, you might want to go ahead. This question is probably for you to answer. When caregivers express needing mental help, is that mainly therapy or medication or more intensive services?
Yeah, that's a great question. The conversation that I had in a lot of these sessions with caregivers, it was around, it was not only around the need for, support groups and things like that, because you definitely need somebody to talk to that's already going through that, currently, or that has experienced it as well. Having somebody that's relatable definitely makes a difference, so you don't feel quite so isolated and alone. But in addition to that, it's pretty darn stressful. You may need somebody from a therapeutic perspective to have some of those conversations, especially if the abuse is really bad. Um, and there's criminal case going on where, as a grandparent, as an example, my son or daughter somehow is part of why this child is going through all that they're going through. You need somebody to have that conversation with to help. I look at it as to kind of help me deal with my emotion, process that, and then step back. And how can I best help the child at the same time? And that's hard. That's why it's challenging and confusing, because you also have yourself and how you feel, and you also have a child and the system, and it's reaching out and having those conversations. Now, as a result, there might be, a need for medication for this question, or other intensive services. But in general, it was just more of, I need somebody that I can talk to help me process my feelings and how to best deal with the child that's in my care and deal with the parents and everything else that's around me.
Thank you. And I see Shannon dropped in chat as well of that there was also a real need for some supports around the child, birth parent, and caregiver. Um, okay, and the last question that we had, if anyone else has a question, you feel free to throw it in chat. But the last question we had listed was, what do the grandparents have to do to be a certified relative care provider?
When you are referring to certified, do you mean that as a foster, as a foster parent? I want to make sure that. Yes. Okay. So we have, as I said, we had new standards come out in regulation on July 1st. So really kind of streamlining that process. Federal requirements that are for every approved foster parent remain. So there is a fingerprint background check, also a child abuse and neglect check, a sex offender check, that those are required for all foster parents. The families will also go through a home study process. As a part of that, we have removed a lot of the paperwork and kind of procedural barriers that we heard from our kin providers. And so all of that now is done through the confines of the home study. We've also, removed a lot of the training pieces. We want the training to be supportive for these caregivers, and the pre-service training that we offer for non-familial families really doesn't meet the need of our kin, right? They already, in most cases, know these children, have a relationship, and need a different type of support. So they are required to only do 5 hours of online training, and those are really just regulatory as far as things that are needed for a foster parent. So those are the main 3 things for relative and fictive kin caregivers, taken down from a very long list, so that we can move more efficiently in getting these families approved, and making sure that they're eligible for all of those supports that they can get as a caregiver. And their home study includes, just a thorough assessment of the individuals that live in the home, and also through that assessing what their needs are. How can we support them in becoming a foster parent? So it's really kind of moving away from kind of the structure of a non-familial home, is looking and saying, okay, you have to do XYZ to be a foster parent, but moving into the space of, okay, how can we support this caregiver in becoming a foster parent to meet the needs of their kin? So it's a different approach, and one that we welcome to better support families.
Hey, Debbie, can I just add one more thing, or 2 more things actually? One of them was Shannon had put in the comments that there was a need for additional supports for the childbirth parent and the caregiver, and I just wanted to elaborate a little bit more on that specifically. I remember in Bardstown, one grandmother saying, she said, "I'm 70, I think she said 72 years old. She said, I'm a single grandmother and I'm raising a 14-year-old grandson." And she said, "There are things that I can't help him with. And he needs someone that, maybe a male figure or something that could kind of help with some of those things, that we need a little more of that type of support." I think that's really important. I remember another grandfather in Bardstown saying, "I think that my grandchildren need to have their own support group, maybe where they can talk about how they feel with other children," because we talk about support groups for kinship families, for caregivers. They need a place where they can feel more normal, where their feelings are more normalized, and they can kind of go through some of that. And so it's in the recommendations, but I wanted to make sure that that really got highlighted, because I think that's super important. And the other thing that I wanted to mention as well, we there was a couple of slides at the end talking about some of the work that was done, the tool that we did. We had some updates done to the Kinship Coalition site, and specifically when we went around to a lot of these listening sessions, we asked folks to share with us, what are your local resources, so that we could gather as much information as possible for caregivers everywhere. And so if you go to our site, kinshipky.org, and you look under resources, you can do that by county. And what it doesn't try to become its own database, because nobody can maintain these things, right? But what we did was we took Kentucky Connect, we took United Way, we connected to a lot of these known organizational databases, plus we added what we knew and what caregivers and those who support caregivers shared with us that may be able to help serve a lot of these families. And we added all of that in there so that you can get a collective view of potential resources for a family's needs. And I think that's pretty exciting. And I just wanted to make sure that that got highlighted as well, because the whole goal here is, how can we best serve children and families?
So thank you. I don't see any other questions listed. I don't know if Commissioner Dennis or Kelly, if there's anything else that you would like to share.
Thank you, Debbie, and Kelly will have maybe something else too. I again wanted to say that this is a priority again for the department. We've been working with KYA, with Casey, Norma, and others, and we'll continue to do so. And these recommendations are very helpful, and in getting that feedback from our caregivers across the state is very valuable. And I think it tells us a lot about how we need to be implementing best practices and policies and supports. So appreciate the efforts around all of that. And again, we're very committed to the work in this space and helping our relative to kin caregivers and supporting them in all ways that we can. And appreciate again the work that's happening in this space. Kelly, anything?
No, I think I would just echo what you said, Commissioner. I think that many of these recommendations are ones that we would love to work together to implement and make sure that families are supported. So just to continue building on our work moving forward.
Right. Well, thank you everyone for attending. Thank you to Casey Family Programs for supporting this work, and for Dolores, Commissioner Dennis, Kelly, and Norma for sharing what's going on and sharing the recommendations. I will say also, if anyone is interested in being an active part of the Kinship Family Coalition, you can also reach out to us. We would love to get you plugged in to that coalition. So we'll be sending a follow-up email. You can look for that next week. It'll have a copy of this recording, so you can share that with others if you would like, in the PowerPoint slides, and also a link to the report and the resources on the website. So thank you, everyone. Have a beautiful Wednesday.